As South Africa continues to observe COVID-19 health protocols, it's necessary to talk about the impact of these measures on families, students and children. It just cannot be ignored that for the first time, the social interaction of families, students and children is highly restricted. Joining us to talk more on this are Professor Boitumelo Diale, an educational psychologist at the University of Johannesburg, Professor Ramneek, Ahluwalia, CEO at Higher Health, Director for Social Cohesion in the Department of Basic Education, Likho Bottoman is here in studio with us, and Rhodes University student Khanyisile Mateke is in conversation with us. I'll begin with you, Prof. Diale. Can a pandemic be traumatic?
Yes, definitely it can be traumatic. As it is traumatic. It's not a doubt. As we see it currently, it is a traumatic context.
And how would you say this has been, traumatic, especially when you look at what some would term the childhood traumas that children go through? How would you measure this in relation to that?
One of the ways of measuring it is through development. As we know that children or human beings grow into different developmental stages. And for children develop through various developmental stages. And part of those developmental stages have to do with contextualization, socialization, with play, with being with other people. And in the context of the pandemic, they find themselves actually being in isolation, which is an abnormal situation. And any abnormal situation for a child impedes on their development and restricts them in terms of how they grow. Theirs has the potential of actually causing traumatic development on children.
Likho, it's been a very difficult balance that the department has had to strike here. I mean, listening to what Prof. Diale is talking about, the fact that the development of children is critical, when it comes to social interaction and all of that. But at the same time, you have to protect them from contracting either COVID-19 or being out there and exposing some of their grandparents to that. It's really been a tricky balance.
Absolutely. I think for many years as the basic education sector, we have been pushing an agenda that says education is a societal issue, because we knew that some of the ideas and solutions that we need to respond to the needs of children are going to emanate from society, from households, from communities. But I think before COVID, we didn't imagine what that should look like. We just had an idea, and the pandemic pushed us into a corner where we now have to put into practice what we mean when we say education is a societal issue. Because what it meant then was that communities, households, families needed to come on board and be more involved in the education of their children. And by education, it also then includes the development. It also includes the facilitation of social opportunities for children. It was really tough. Now, it's easy to reach children when they are in school. And I think that's why we've been pushing very hard, with all our partners in academia spaces and in civil society, that children must come back to school because it's easy for us to reach them. But when they are at home, in homes, in households and communities, it becomes difficult. Then it means then that responsibility lies with households. We can only give ideas, but households and communities and families need to then come on board.
It also lies with households, though, Likho, households that are they themselves struggling. They're impoverished, some of them, and they don't even have the means to connect their children to this online learning that, some grandparents, if I can even put it like that, had to try also see if they can navigate. Now, this has, in fact, once again, sparked the debate between the haves and the have-nots. And when you then are looking at that, how do you envision a future then for schooling? Because this has changed how we reimagine anything.
I think you're correct to say that it kind of pushed us again into a corner where we've got to deal with children on an equitable basis. So you deal with children, those who have got access to these online, digital and virtual platforms and opportunities, whilst you onboard more of them to be able to do that. And we've made quite a considerable amount of investment to ensure that more children gain access onto online, virtual, and so. But you're correct to say that. But then all of this is coming into families where there is no familiarity on how to navigate and how to facilitate, how to use this. Coupled with that is this thing that we call read to lead, where we say, let's promote reading for pleasure. We know that reading is a technical activity that can only be facilitated in the classroom. But in order for us to prevent regression of children, we've got to then promote reading for pleasure. Anything that families pick up that is developmentally and age appropriate, that they can read together. So we're saying that read for them and then read with them. And so when you read for them and with them, you have an understanding of how far your child can go and how far you can then stretch them as you facilitate that kind of learning. So just because you don't have access to online platforms does not necessarily mean that you can't do anything. Sometimes there is learning through play, that if you play with your children, you're able to, to infuse some of these learning principles through play.
Interesting. I'd like to bring you in, Khanyi, to this conversation before I bring in Professor Ahluwalia, who, I'm going to ask just to also share some insights on what you raise. Let's talk about you. You are far from home. Your parents, sent you to school in Grahamstown, and you are separated from them. And there's been levels of lockdown where you've not even been able to travel to see them. Talk to us about the impact that this time has had on you.
It's been extremely stressful because on one hand you have the pressure from school that you are urged to complete your degree in record time, and then you have this pressure from family because I'm the first one to go this far from home for my studies, and being alone has been very tough because I've grown up in a home where it was very hands-on, especially with our schoolwork, so they kind of know the type of learner that I am. I'm figuring that out for myself.
Khanyi, I'm going to ask them to try and sort out your line there, because what you're saying is quite important. I'm sure you were not even, able to hear some of it, but what I could hear is that she says that she comes from a close-knit family where everything was done together. Everybody got involved and all of that, and now she's finding herself alone and is struggling a little bit. Khanyi, you were still saying that for you, you are far away from home and you are used to having your parents hands-on when it comes to your schoolwork. Talk to us about how the distance is impacting you.
It's been hectic, I'm not gonna lie, because also the fact that it's still lockdown, the pandemic is still quite hectic. The fact that we need to isolate and you can't see friends as often, and even when you're with them, you can't really have these study groups that we used to have and everything. So being alone and studying on your own and figuring out exactly how you specifically need to try and get through this time to complete your degree in record time has been quite challenging. The school has really tried to be hands-on, but at the end of the day, it really takes a lot out of you as a person.
Prof. Ahluwalia, I'm listening to Khanyi talk about the social interaction that she's craving, and not only just to spend time with her friends, but also to study with them. And this social interaction is not only huge for children, but students as well, because they also are looking to their peers for some kind of assistance. How big of an issue has this been for institutions around the country?
A very big, Bongiwe. In fact, Bongiwe, when we started with COVID-19, we knew it's a health pandemic. But as we have matured with this pandemic, we've now seen two more pandemics, which is COVID is now regarded as a social pandemic, and COVID is also now regarded as an economic pandemic. And let me explain to you why I mean there are three pandemics, the health, social, and economic pandemics running together. Like Khanyi, there are many more young students. We've got about 2.5 million of them, say universities, in TVET colleges, in rural areas, in peri-urban areas. And what is impacting is, imagine a young student at home who's losing out on study times, who has parents who probably are losing jobs or having economic challenges. Our study shows that over 40% of students are even struggling with food security in these difficult times. They are in households where there is lack of study space, time. Electricity is a huge challenge. We are a developing country at the end of the day. Internet, data. And then there's a huge pressure on them, which is skills development, to become a graduate, succeed exactly the way they were supposed to succeed. Except for UNISA, almost all our institutions, including schools, were built for contact learning. And when we talk about contact learning, there's a meaning of contact learning. A lot can be done through a hybrid model, but cannot be achieved without a contact learning. And that's putting a huge psychosocial distress on young people. Say 65% of our young people, through our study, which has been done across all our universities, TVET and CET colleges, has clearly shown 65% are suffering from moderate to severe anxiety, depression, and mental health disorders. And that's a reality. And this is predominantly a pandemic which is now impacting the society, impacting the economic situation, and it's gonna, as it continues and matures, it's gonna continuously impact the development, exactly as Professor Tumi was saying, and that is exactly what we are worried about, because as a skills development system, we cannot afford to have this, and that's where we are worried about.
I'm going to continue with this conversation in just a moment. And Prof. Ahluwalia, you touched on something that I'd like us to look into after this, the pressure that these children are finding themselves with at home, because there's also parents themselves who are overwhelmed during this time. Some of them have lost jobs. Some of them are struggling with just the impact of COVID-19. And now you have young people who are just as overwhelmed. So how do we then begin to navigate these spaces? Let's continue with this conversation in just a moment. Let's continue then with this conversation as we look at really the well-being of children and, students, as well as, university students, in fact, and high school students around this COVID-19 time, during this pandemic. How should we be dealing with some of the challenges they faced with? Now, Likho, one of the things that you were talking about, just before we came back from the break, is that it's not only about studying. It's not only about saying to your child, I need you to study now, but it's also just looking at the factors around them and being able to see them when they're not okay.
I think what happened, Bongi, before COVID was that we got so busy in our homes, but we always had the school to defer to. And when that deferral point was removed from us, it was just us and our children. And now the COVID-19 situation was very terrible for us as a country, because even us as adults, we were still trying to find our way around it. We're not so certain about what we're going to do, what tomorrow is going to look like, what we're going to do the next day and the next week. And so our children were looking to us as parents to be able to give that kind of guidance and the kind of assurance that it is going to be okay and that this is what the future looks like. And it was impossible for parents to be able to do that. And so parents were confronted for the first time with socio-emotional issues that their children have to deal with. Some of these children were locked up in their homes with perpetrators, for example, of sexual abuse. And at least when they were in school, they had that time to be away from their perpetrators. And now with lockdown, everything is here. And we, as the department, we can't help them. They're locked in there. And so we had to also intensify the work that we're doing around the protocol for the management and reporting of sexual abuse and harassment in schools, so that children know that even if we are under lockdown, we are under COVID-19 lockdown, we will still be able to listen to them if they come forward to say that they're experiencing challenges, they're experiencing abuse at home. We needed to assure them. We needed to make sure that we reach out to them using our civil society organizations and community-based organizations that will be able to get into the communities. Because I said earlier, it's difficult to reach them when they're not in school. And so you have to find innovative and creative ways of reaching them even during this difficult time.
Prof. Diale, one of the things that Likho is mentioning here is parents that are also overwhelmed, and there's a lot of people, especially when it comes to the support structure of children, who themselves are overwhelmed. How do overwhelmed parents deal with overwhelmed children?
I think you cannot give what you don't have. So if parents are overwhelmed, there is no way they can be able to help their children who are overwhelmed. So it is important for us to look at a holistic approach, as Likho says. We cannot separate the role the parents, the role the children, and the role the school plays. And for a long time, as educationists and psychologists, we've spoken about a whole school development or a whole community development. And this was the perspective that we were coming from, to say, we are separating things that are not inseparable. We look at school as its own ecosystem on its own, the family as a system on its own, the community as a system on its own. And the pandemic has shown us that we cannot separate those. Therefore, the important thing is for us as mental health caregivers to begin to give skills, to begin to help parents with approaches, with interventions that help them to identify themselves, to say they're struggling. One of the key things parents purely, even if they're struggling, they cannot say to their children they're struggling. And if you think of the little ones, you teach them, I went to school at Khanyisile, and my ABC is not the upper K. And now I have to teach this child the upper K who's going to a Model C school. And my child feels that I'm not at that level. And as a parent, I'm not confident enough to take them through that. But also the emotional part of it that comes with that I have to balance the different balls of being a mother, being now a teacher, but also being an emotional caregiver for this child who cannot go out and be a child and play with others. Therefore, it is important, I would say to Likho, in addition to the protocols of the, for instance, the GBV or the violence that is happening in terms that they have, the protocols they've done around that, we need to look at intervention strategies that support parents and other caregivers so that they can be better caregivers. If they are not taken care of, we are sort of losing a battle. So this is a holistic ecosystemic perspective that we need to look at this.
For you, Khanyi, how have you coped? Especially because you, as you said, that you are battling with not having as much interaction with either family, lecturers, your peers there, where you are in Grahamstown. How have you then been coping?
I wouldn't say I'm coping per se. I'm getting through it. I think it's still, I don't know if will ever be in a position to say we're fully coping, because it's like just when you think you've gotten used to a certain structure, we go back into a higher level of lockdown, and there are certain restrictions that restrict you from going to the library, for example, at certain times of the day, or don't allow for campus learning, and restrictions on how much data they give and to which students they give it to. So the best way I've been coping is just trying to really, really understand what methods and study methods work for me specifically as an individual. Like, in as much as they have all these seminars at school and things like that, I really had to take time to figure out what works for me.
And when you talk about what works for you, I'm very interested in how online learning has been for you.
It's been quite challenging. First of all, data has been a very huge problem.
As she talks about data there, then the bandwidth plays. Khanyi, I'm going to ask that they try to give you a better line. As we talk about data there, then the bandwidth starts to really mess with you there. I guess the data must fall movement is not particularly popular there where you are. But Prof. Ahluwalia, when we look at and listen to what Khanyi is saying, how would you then best say institutions deal with this, at a practical level? Because she's, as she says, she's not coping, but she's simply just living through it.
So, Bongi, one important part which we have learned in this whole pandemic is there's been an opportunity called technology. And as much as there's been an opportunity, what we never knew that we can ever replace contact learning through some kind of open learning, we learned it, and people were forced to learn the technology. Technology was growing. But what we have now realized is that you can't replace interactive learning or practical learning. And so the advice from my side to all our institutions has been, and exactly what we did, say last year, June, July, when this virus was new for us, our levels of lockdown started slowly, gradually going down because we had to open our economy, was to still continue a hybrid mechanism. And my advice to the institution is to not lose the contact learning element, which is how do we make our classrooms to a 50% capacity? How do we adhere to protocols? How do we ensure that we have strictness with things so that we can balance an online distant learning versus a contact learning? Because as a doctor, I can't see myself having so many other graduates in medical schools becoming on virtual training to become doctors, and similarly applies to miners, electrical, plumbing, and higher education, just not universities. We are forgetting we've got technical colleges, which are practical learning colleges, skills learning colleges, and that pressure is mounting on our people. The advice is get vaccinated, because if we can get our vaccination program rolled out the way we are trying to, we can, and the world and global world has shown that if we can get our population vaccinated, we can get back to normality. So I think the advice is for parents to not lose the contact learning element, try some kind of, through even practical ways of understanding of how can still interactive learning can happen. There is an extra effort on them. There's a lot of burden on them. They're losing their own parents. A lot of students have lost their parents. So it is a mess actually at this moment with the crisis we are dealing with in economic situations, so social issues. And in that, we need our population to be resilient and continue this hybrid mechanism till we open our system in open learning in totality. And it has to open one day.
Professor Ahluwalia, for a parent watching tonight, what would you say are the signs to look out for when it comes to young people who are buckling under the pressure? So,
very important. I think parents, first of all, I fully agree with you what you're going through at this moment. But at this moment, you also need to be resilient about yourself, because you're facing it, but you also need to watch out something very critical in your young lives that you have produced are in front of you. Watch out sleeping patterns. Watch out food eating patterns. Watch out a lack of concentration among children. Watch out if your child is staying alone or not wanting to mingle with others. Watch out any sign and symptom in the early stages where it identifies the psychosocial distress in your system. And with early stage, if you can get help, an educational psychologist is right there, but clinical psychology, counseling, social work support, they all exist around us. And the aim is to reach out. Bongi, I always start by giving you a number like 0800-363636, toll-free 24-hour helpline.
Please give us the number again, Prof.
0800-363636, toll-free 24 hours. Whether you are in 2 o'clock, 3 o'clock, you should not deal with the psychosocial crisis alone. As a parent for yourself or as for your children, make sure you reach out to a counselor, social worker, psychologist. A lot of suicide we are seeing among young people. It is a difficult time, and this is a reality. And if our studies show us, we know what the in-depth situation is at homes at this moment. So watch out any psychosocial distress, because we need to look after people at this moment.
Khanyi, we are nearing the end of this conversation, but I'm interested to find out for you, how have you been keeping in touch with your family? Are you able to video call them? Does it make it better?
Video calls have become so rare because, like I said, the data prices have really increased. It does make it better knowing that I do have a support structure that I can go to. But the fact that I don't have my social interaction with them, like physical interaction with them and people around me, is so limited. and there has to be this big distance between us. It really amplifies the fact that, like, we're alone in this, you know, in a sense. Like, even though you're trying, and then there's like Prof just gave us the number of toll lines and everything that are in place to help us. It just really, it really still amplifies the fact that we are really alone in this. Like, you still need to try just as hard as somebody that was on campus, because it's something so new to all of us. Like, and that's why I can't even fault any of our lecturers or professors or tutors or anything like that, because we're all going through this for the first time. We're really just trying to help each other, you know.
As we round up this conversation, Prof. Diale, I'm going to come to you in just 30 seconds. Some say that, you know, children bounce back. They'll be fine. They'll be able to bounce back from this. But it won't be as easy as that, will it?
It wouldn't. Yes, there is. Children in their own nature have got some form of resilience, and we need to acknowledge that. However, we shouldn't assume that it happens automatically. Bouncing back happens with systems put in place. And as Prof. Ahluwalia said, there are systems that are professional people who are trained to help children go through. I believe if those systems are put in place, really, they can never be back to the normal, but we can have a situation where children become better teenagers and better adults in this situation. However, it is important to use all these systems that are there for interventions.
Likho, in 15 seconds, what do you say to children who are watching tonight who are saying that they are finding it difficult to cope with the basic education department?
I would be doing disservice, Bongi, if I don't acknowledge the existing support system that is there in communities through faith-based organizations, community-based organizations, and so forth. And I would say to those children that if you can't find it in the school, please reach out to those community-based organizations that work with child protection programs, because I'm sure they can link them up with the kind of help that they need to survive this difficult time.
I'd like to thank you all for your time tonight, because we had really an important conversation that we had tonight. I'll remind you of that number again on your screen. If you are in an institution of higher learning and you're battling to cope, 0800 363636. That's the number to call, so that you're not alone, and you know that, as Khanyisile says, that she feels alone, but at least there is somebody that can navigate these waters with you. Thank you so much to you all for your time. That was UJ's Professor Boitumelo Diale, Professor Ramneek Ahluwalia of Higher Health, Likho Bottoman from the Department of Basic Education joining us in studio, as well as university student Khanyisile Mateke.